So we looked at our center, and we are one of the larger myeloma transplant centers. So we looked at our database because we all know that the outcome of patients with multiple myeloma has improved significantly in the last 2 or 3 decades, thanks to the availability of a number of newer and effective drugs, appropriate use of stem cell transplant, greater safety of stem cell transplant, use of maintenance treatment, and better understanding of biology. So we found more than 3,000 patients in our database who had received autologous stem cell transplant at our center. And we divided them into 5 different groups. The earliest group was between 1988 and 2000. We did fewer transplants at that time, but still we had more than 200 patients. And then we had 4 additional groups between 2001 and 2021. So we looked at the outcomes between these 5 groups. So first, in terms of characteristics, what we noticed was that now we are treating patients who are older, who had higher risk cytogenetics, and who had significant comorbidities. So when we looked at that, there were less than 1% patients who were 65 or older before the year 2000. Most recently, 38% patients were 65 or older. Similarly, more patients had higher comorbidity score, showing that they had a number of other medical problems. But despite that, what we also showed was that with more recent time points, there was a significant improvement in outcome. Again, it's partly because more patients are now receiving proteasome inhibitor and immunomodulatory drugs. 74% of those had received that as induction, while before 2000 these things did not even exist. And what we also saw was that there was a significant improvement in both progression-free and overall survival. So before the year 2005, the median progression-free survival was very low, was less than 2 years in those patients. But in the most recent cohort, it is 5 years or longer. Similarly, even in high-risk patients who have more aggressive disease, there is a significant improvement with each passing decade, basically. And again, those patients are doing better. And then safety, treatment-related or transplant-related mortality in earlier cohorts was as high as 5 to 6%, which is very high for autologous stem cell transplant. But in the more recent cohorts, it's less than 1%. So again, showing that even though we are treating older patients, patients with more aggressive disease, patients with significant comorbidities, but because of all these other things, the outcomes continue to get better. And we expect that with the use of quadruplets and the availability of even more effective treatments like cellular therapies and bispecific antibodies, we'll only see an improvement and significant improvement in coming years, which is great news for our patients.